Good evening and welcome back to my YouTube channel. This is Sister underscore Dina. Thank you very much for tuning in. First and foremost, thank you for my subscribers from my last video. Thank you for the 25 people that subscribed, those that liked, and I'm very grateful. This evening, I just thought of coming on um, to talk to you and just share my feelings on a particular issue. I know I said that I was going to continue um, talking about Iammayugno Nyabohanze village and the many people that have been touched, and just sharing how their lives have been transformed. But I'll do that uh, in the other videos that are coming. But today I just thought of coming on for a few minutes because I saw a post on FB where somebody was asking why so many content creators seem to be talking about mental health issues, and it seems to be everywhere. Um, and being mental health champion myself, I thought of saying something about the issue. First and foremost, as we speak, mental health has become a very big issue, not only in Kenya but all over the world, meaning people are faced with mental challenges. And just like during the 80s and even 90s, HIV and AIDS was such a big issue. And initially, society didn't really want to talk about the issue openly. And there was a lot of stigma associated with HIV and AIDS. And for the longest, those that were suffering, those that were affected and infected, didn't have a place, so to speak, to share what they were going through. And that resulted in really a lot of problems because it was not easy to find solutions, since people were very scared and really ashamed of what they were going through. And so when I saw this post, I thought I need to say something about this. First and foremost, like I've said, it's a problem that has really been exacerbated by so many things. The hard times that people are going through, the challenges really that people all over the world are dealing with, economic challenges that affect so many aspects of our lives. And so even with the COVID pandemic, mental illness the numbers went up. And so it is important, first and foremost, to try and understand those that are mentally ill and those that are suffering, because mental illness is just a disease, just the way one can have malaria, one can have um, uh, cancer or diabetes. It's a disease, and it's very serious public health issue that must be dealt with seriously, because it is affecting very many families, very many people, and changing people's lives dramatically. When one is mentally ill, the disease really becomes a family illness, because even those that are taking care of these people, because of how demanding and just how involving it is, the carers also are affected. And so we need for society to be to show more compassion and empathy towards those that are affected. Another thing is that mental illness is not a sign of one's weakness. As I said, it is a disease, and anyone can be affected, either environmentally, and also it can be hereditary. It can also be drug induced, and it affects all cadres of society. And really, there's nothing to be ashamed of if you're out there and you're suffering. Of course, in our country right now, we are not yet there in terms of even how mentally ill people are taken care of or treated. We still are grappling with even the simple fact of people coming out and saying that, yes, I am mentally not okay, and families also coming out and saying, yes, this is our brother, our sister, our dad, our mother, and he or she is dealing with mental illness. We also don't have facilities, enough facilities to deal with the many people that are dealing with mental illness. And so the question on FB that why are so many people dealing with mental illness issues as content made me want to come and just encourage people that that is a good thing. It is a good thing that people are actually out there talking about this thing that for the longest time has been taboo almost, and has been looked at as a weakness, some a curse, and just those that suffer have been loathed, so to speak, and just ostracized in society. And that shouldn't be the case. You don't see people do that to people suffering from other illnesses, chronic terminal illnesses like probably cancer or diabetes. In fact, with those other diseases, there's a lot of compassion and empathy and wanting to be of help. I think we need to get to that point as a people, and try and understand that this thing is here and it is affecting so many families. And if we are to get solutions, we need to start by being humane and sensitive towards those that are affected. I also think that it is important that conversations like these ones are done at the family level, in the community, so that people can start getting used to this talk, and therefore making the space safe for those that are hurting. I laud those that come out and share their stories and are brave and courageous enough to call it like they see it, and just tell us about their journey and how they're living with these conditions and how they're trying to cope and live meaningful lives even after they have been diagnosed with the different mental illnesses that are there, the disorders. And so this evening I just felt it important to urge us out there to not be ashamed. Don't feel judged. Know that there is help out there. Speak and seek help, and know that you're loved and you're not less. You just have a condition that if and when discovered early, you can still live a very fruitful life and really contribute to nation building and really add value in society as a citizen. I just want to urge those that have mentally ill people that they take care of. I know it can be overwhelming, it can be lonely, it can be a very scary place. But as always, God is a present help in time of need, and the family must come together and rally around such people and support them as they support those that are hurting. This is a very close subject, and I'm passionate about this issue. And we must continue encouraging, sharing the stories out there, and just creating safe spaces, whether it is in the home, whether it is in the office, whether it is in schools and learning institutions. We must do this because it is only when there's a big number of us doing this and advocating for mentally ill people, that we are going to make inroads. Otherwise, I felt that I wasn't going to sleep over this. I felt I had to say something, and I will continue to do that in my subsequent videos, and continue to amplify this issue, and make it known that it is here and we must deal with it decisively. I just want to say thank you for taking your time to come on and be with me this evening. As I said, I will continue with the videos that I had promised earlier on Iammayugno's village, him himself, his achievements, and just the impact that he's had on his community. I think he's been such an encouragement, and we cannot, just as I know so many times we think that there are no good stories out there. I think there are so many good stories that don't get to be told over and over again. It's the bad stories that get to be told over a gazillion times. So I'm making it my business to tell the good stories over and over again. And Nyabohanze and the young people in that village and community are exactly that example. So thank you. Kindly subscribe, like, and share the video. And more importantly, thank you for sharing this evening with me. And please, let us be kind to each other, because we never know what people are going through. Thank you, and God bless.